Hello, everyone. This is Marie Morrison with the Canadian Alliance to End Homelessness, and you have joined us today for one of the by name list and coordinated access webinar series presentations. I know we're getting very close to the holidays, so we're very glad that you can join us, but we are also recording this today, and we will share the recording and the presentation on the Training and Technical Assistance website under the webinar section. So you can expect to see that coming out. You'll see that Wally Check is not your host today. Wally is often hosting these, but today Marie Morrison from, again, the Canadian Alliance. I'm with the Built for Zero program, and also we have Ashley Vandermark from Built for Zero on the line, who's helping to monitor your questions that come through today. And then we have our presenter, of course, Ian DeYoung. But I will just say about the Canadian Alliance to End Homelessness, you're aware that we have 4 key initiatives: the National Conference and the 2020 Conference. Information is now kind of getting started. That website's getting started. There'll be a call for proposals soon. The Built for Zero Canada initiative, the Training and Technical Assistance initiative, which the 2 of them are working together to host the by name list and coordinated access webinars, and then the allied networks. Our mission as an alliance is to lead a national movement of individuals, organizations, and communities working together to end homelessness in Canada. And this webinar series and the other work that we're doing with communities to support the implementation of by name lists and coordinated access is funded in part by the Government of Canada through the Community Capacity and Innovation Funding stream of Reaching Home. In all of the webinars that we're now doing monthly, our purpose is to provide you some information, ideas, and best practices. It will be an hour long. We will have likely time for questions at the end, but primarily we'll be hearing from Ian DeYoung today of OrgCode, all about assessment. And as mentioned before, it will be recorded and the PowerPoint PDF will be available as well. So, that being said, and with no further ado, you can see some contact information there, but I am just going to flip over to Ian's slides. And Ian, I will have you introduce yourself further if you can.
Well, a very good day to everybody and the best of the holiday season. For most of those who are listening in, I imagine it's appropriate to say happy afternoon, except for some of our West Coast participants where you're soon approaching the afternoon. Today's purpose is to look at the assessment part of coordinated access. And we have done a previous webinar on access points. This webinar is going to focus on assessment. And then we will be moving into another webinar early in the new year, looking at prioritization. So the 3 parts of the series are intended to make sure that we can have all the key ingredients of coordinated access covered through the webinar series. I certainly urge you to ask whatever questions you might have in the chat function as we go through. As Marie indicated, Ashley will be helping moderate the questions that come through in the chat function, so we'll make sure that we're staying abreast of those. The materials that I want to present today will take approximately 30 to 40 minutes, so we will have time for questions today. Unlike access points and prioritization, where the full hour is likely needed, the assessment part we can probably cover off in the 30 to 40 minutes. The purpose of today's webinar isn't to get into specific assessment tools, but to look at different elements that you might look for in an assessment tool and the assessment process as a whole.
And Ian, I'm assuming you can now see the slides, and your slides are up there.
I can see my slides. I just need to see the for moving forward. There we go.
Yeah, you just say next when you want me to move it.
Okay. So the purposes of assessment, next. We'll get into these in greater detail as we go through, but I start with this idea of a deeper dive into serving needs. So the first thing that we look at is this idea of it being supplemental additional information to understand and meet needs. By no means is an assessment tool the only way in which you should be understanding and capturing needs of individuals and families that are experiencing homelessness, and that might be part of your coordinated access process. You may have additional intake forms and information that you're collecting in that regard, as well as case notes and those sorts of things that are absolutely critical to the ongoing engagement with people and families experiencing homelessness. And I think that assessment tools can help round out that information quite well, but shouldn't be relied upon exclusively to give you all information about an individual or family. Information can be used as part of existing service supports. So while we think about using assessment data in the coordinated access process, we also have the ability to use the information as part of existing service supports. So you might think about, let's say, a family that's currently within a family shelter, that you're providing some resources and supports to help them during their experience of homelessness. You conduct the assessment as part of the process of moving forward with coordinated access, but it actually might reveal information that becomes very important to service delivery while they're still in shelter, aligning community-based resources and thinking about other community supports that might be advantageous once they move out of shelter. And to that end, it can also help prioritize which individuals and families require more services while they're homeless. And this idea of a more robust service is going to be absolutely critical for thinking through how do we go about ensuring that we have a high level of support and services for really acute individuals and families during their experience of homelessness, and also be thinking through which individuals and families might need much more supports in the process of moving forward with coordinated access to ensure connectivity in the match process. Next. We're also going to use the information for prioritization and matching. So this is part of the information that we use to help get the right person or right family to the right type of housing intervention relative to their needs in the right order in this transparent and common approach. And when we say part of the information used to help the person, let's say, for example, that your community in a prioritization process has decided that you want to ensure that individuals or families who are experiencing chronic homelessness are also prioritized. The assessment tools that you're using may or may not give you that information explicitly, so you might have to capture information on length of homelessness in order to do that successfully. Another example of information that you might be collecting in the prioritization and matching process could be things like, as we moving forward with initiatives to better support veterans who've experienced homelessness, you might need to know about things like military history of service, and that isn't necessarily captured in the assessment process. But by and large, most of the information that you capture in the assessment process will provide information relative to acuity and depth of needs that is necessary in the assessment process. Next. I'll be going greater on these factors towards the end of the webinar, but I just wanted to highlight them in the very beginning in terms of purposes of assessment. It can be a benefit to research. So we've definitely seen, for example, in the use of some assessment tools that organizations, academic organizations, have used the information to better understand, for example, the needs of unsheltered populations. We've also seen academic research occur using assessment tool data to better understand the service needs of youth experiencing homelessness. We also can see that the research happens at a community-based level, wherein organizations that are working to better meet the needs of individuals and families use the information in a robust way to help better come to understanding at a deeper level relative to the needs of the populations that they're serving. We can also see the information used to inform funding and address emerging needs and gaps. And this idea of emerging needs and gaps is an important one in assessment data, especially when the assessment data is time-stamped. That is, we know the date under which it was taken. So you might think of a community or an organization within your community that says something to the effect of, we're seeing an increase in young people with severe mental illness? Well, you can look at your assessment data and actually say, one, are we seeing an increase in youth? And two, are we seeing the parts of assessment that are related to mental health scoring higher? So it can become a validating part of the observations that happen in the course of service delivery. Can also be helpful in preparing applications for funding. To this end, we are starting to see an increase in the number of organizations and communities that use their assessment data when responding to requests for proposals to highlight the specific population groups that they're serving, as well as their the matching process of coordinated access. We have to ask ourselves, for what are we assessing? And when we think about that, we should be looking at understanding needs and demands by population group. So one of the things to keep in mind as you move forward in your assessment process is that you will have a small number of lists, and these lists, it could be part of a broader by name list where they're all incorporated together, or when we get to the actual matching process, separating them by population groups. So at some point in the process of moving from assessment through to matching, you'll need to be able to look at the specific needs of youth, families, single adults, and those impacted by the experience of intimate partner or domestic violence. And when we think about understanding the needs and demands by each population group, it should very well be that the needs of singles are understood different than the needs of youth, which are understood different from the families, which are understood different from those people who have had the experience of domestic or intimate partner violence. When thinking about understanding the needs of each population group, this assessment data should help inform the ways in which your community goes about prioritizing and the ways in which your community goes about examining their existing resources for those specific population groups. When we think about those population groups, it's really important to keep in mind, however, that you should not be choosing different assessment tools for different population groups per se, but rather looking at the connectivity across population groups in the assessment process, because that will result in different types of housing interventions. Next. So we need to make sure that whatever assessment tools and processes you're using in your community transcend just one type of housing support intervention. So for example, yes, you might know, based upon acuity and depth of need that comes up from an assessment tool, which individuals, youth, or families, or survivors of domestic violence would be good candidates for supportive housing. And that's a good thing. However, the tool should also be able to highlight for you, for example, which of those households would be good candidates for rapid rehousing, a more moderate, less intensive type of housing intervention. Next.
So Ian, I just realized I can turn the mouse over to you. I think you would probably find it easier for you to do it for your slides yourself if you want, or I can continue to do it.
Okay, I'm just looking for the little arrow thing. It's usually in the bottom left-hand corner.
While you're doing that, I can take you to your next slide, but just anytime you figure it out, you can take it over.
Okay. So we look at what are the dimensions of a quality assessment. And when we look at quality assessment, there are certain variables that we look at. And the Government of Canada isn't the first to think through elements of quality assessment. This has certainly happened in other countries and jurisdictions that have used coordinated access and common assessment for longer periods of time. So let me get into those. Next. So what do we look for and sustain in an assessment tool? So the first thing that we look for is that the tool that you're choosing to use has been tested, proven, and appropriate. Now, to that end, you may be choosing an existing tool that has already been tested, proven, and appropriate. But your community, and there's nothing that prevents you from doing this, might have entered into the space of saying that you wanted to develop your own assessment tool. To that end, you're going to have to make sure that you take the necessary steps to test the tool. Does the tool do the things that you expect it to do with the population group with which you're administering it in the way that you expect it to work? That you can prove that the assessment tool highlights and demonstrates the specific information that is going to be necessary for coordinated access, and that the tool is appropriate. And when we think about the appropriateness of tools, we can also think about the appropriateness of either the tool or the process of administering the tool for specific population groups. That the tool provides consistent results. So consistency, especially if the tool is relying upon self-reported information, is going to be somewhat subject to the way in which the participant chooses to provide information. But if you were to look at a large volume of assessment tools after they're applied, you should see consistency in terms of the scoring ranges as it go through the process, for especially when compared to known information. Next. That the tool itself is strength-based. Now, when we think about strength-based applications of a tool, this doesn't necessarily mean that it inventories all the strengths of the individual. Sometimes the strength-based element of an assessment tool is how the information from the tool is actually applied. Now, most tools are going to highlight specific areas of need for the individual or family, and that's okay. It would have a deficit orientation if all we did was focus on those things that were highlighted within the tool, which were areas of higher acuity. However, you can use the tool in such a way that, the opposite of there being noted issues for improvement could be areas that are demonstrated as strengths. Furthermore, in looking at the results from an assessment tool and processing those results with the individual or family, you should definitely take a strength-based approach from the initial engagement, as opposed to just focusing on all the areas where there's higher needs or more acuity. The tools should definitely be aligned to housing first, and in so much as we are looking to try to assist youth, individuals, families, and people who have experienced domestic and intimate partner violence in moving forward with access to housing without precondition. And to that end, there should be no information that's gathered throughout the tool that is going to be highlighted within the community to say that someone, for example, is not housing ready. We also should try to avoid further traumatizing individuals or families through the use of the tool. And we can't guarantee with any assessment tool that it won't have some elements that are potentially re-traumatizing, but they should not be deliberately so. And so as part of the testing of the tool in its development, the tools that are most commonly used have gone through a great process of ensuring that they are less likely to be traumatizing to people. If you're creating your own tool, it is something definitely to be paying attention to. And finally, it should be as user-friendly as possible. So that means that the administration of the tool, while it can require training and a resource book, should be able to be applied by housing and homelessness support workers throughout your system of care, as opposed to requiring individuals with specific expertise in the likes of, let's say, mental health to administer the tool, so that the tool can actually be applied far and wide within your community's continuum of services. We also want to see consistency across populations. To that end, let's look at what Reaching Home puts out as their minimum requirements. This comes from the guide that the federal government has produced on reaching home and coordinated access. It reads as follows. Communities must use a common assessment tool for all population groups, for example, youth, women fleeing violence, Indigenous peoples, so that there is a shared approach to understanding people's depth of need. However, the questions and approaches to conduct the assessment can be adjusted for specific populations. For example, a conversational approach rather than an interview-like approach may be more appropriate for Indigenous clients. As I interpret this and understand it, what we also have to be sensitive to in the process is making sure that we're not carving off different tools by population group. So that's one thing to be thinking about as we kind of go through. But also, we're thinking about the actual application of the assessment tool. So if you're using, for example, one of the more commonly available assessment tools, almost all of them come with different approaches for implementation of things like a conversational approach versus an interview type approach for different population groups, and not limited exclusively to people who identify as Indigenous. Next. In order to complete an assessment, there must be consent. So let's look at the ways in which consent applies in the implementation. So the first is the consent to conduct the assessment itself. So we cannot do assessments on people that do not provide explicit consent to actually have the assessment done. So without consent, no assessment. That means that as you think through the implementation of your assessment tool in your community, you cannot use observation without informed consent. In other words, you can't fill out an assessment tool on behalf of someone else. There should never be instances where assessment is done without consent, and this consent itself could be part of a broader program consent, or it can be specific to coordinated access. Let me talk about that just a bit further. Many communities in implementation of coordinated access who have been at it for a period of time have found it advantageous to ensure that the consent to conduct assessment is actually included much further upstream. This could be at the time when someone initially engages with the likes of an outreach shelter or drop-in center type program, or it could be part of introducing the overall coordinated access process where you want to gather that consent there. But either way, we want to make sure that as part of a broader program consent or specifically for coordinated access, the consent is in place prior to conducting the assessment. As part of this consent, we need to make sure that sharing information is allowed. So it's not just that we're getting consent to conduct the assessment, we're getting information to share the information from the assessment with the likes of service managers or service planners, whether that be, for example, in Alberta, the CBO type function, or Ontario, the service manager function, that we want to be able to share information across homeless service providers, and we want to make sure that we can share information with any organization that will be involved in the provision of housing and or supports. And when we get that consent to share information, we want to make sure that encompasses all possible ways that the information might be shared. So a good consent, for example, would be clear that information from the assessment may be shared electronically, which can include the use of a database like HIFIS or another homeless management information system, as well as through case conferences or communiques between relevant parties. In other words, we want to include as broad an understanding of information sharing as possible, again, so long as the parties are relevant to the conclusion of the individual or family's homelessness. We also need consent to store the information. The storing information, in most instances, applies to the typical HIFIS or HMIS consent that says that information is going to be stored in that particular place and used for a specific purpose. And in those instances of using an HIFIS or HMIS, the assessment data becomes part of the client record within the database itself. So if I were to pull up information on Ian de Jong, what I would see is not only all the demographic information and case notes from services that I've received, I'd also be able to look at information specifically related to the assessment data itself. When we think about that access to assessment data, like any data that's shared within a database, it's important that there's appropriate controls in place and that only parties who are relevant to the movement of helping that individual or family progress towards housing and receiving services while they're homeless has access to the information. When we think about the completion of assessment, we're thinking about the application of assessment across all populations. It certainly was the experience in some jurisdictions, particularly in the United States in the early days of coordinated entry, that some communities went down the road of saying, we're not going to complete assessments of certain variables of the individual or family in place. That was then changed in guidelines and regulations in the United States, but it was a helpful lesson to learn to make sure that we don't make comparable mistakes in the implementation of coordinated access in Canada. So let's look at those reasons that do not prevent the completion of it. So we don't screen people out of the assessment process because we say they don't have enough income. Regardless of income and source of income, assessment applies. We don't look at people's credit scores and make a determination from that. We don't look at their rental history as an indicator of whether or not an assessment should be done or not done. So even if they have a number of evictions or rental violations, we're still going to complete assessment. And that could include people who don't have any rental history whatsoever. We're still going to conduct assessment with those types of individuals and families as well. If someone is a domestic violence survivor or fleeing abuse, we're also going to be able to conduct assessment. And we have to look at the most relevant and appropriate time to complete that assessment, but we're still going to make sure that the assessment is done. We'll also ensure that the assessments are completed with people who are currently or have past had substance use as part of their life. And we are also going to say that we can complete assessments with people that have resisted services currently or in the past. Now, they still have to consent to do the assessment, but just because someone has been in a position where they've said no to certain services in the past doesn't mean that we stop them from being able to participate in the assessment process if they so desire. And we will do assessments with people with criminal records as opposed to screening people out now. There could be housing and support programs in your community that, for example, require people to have an income as a condition of being housed. Or, for example, you might have like a sober living facility that requires people to be absent and have ceased using alcohol or other drugs as a condition. There still can be a place for some of those programs that have lots of restrictions, with different discussion for a different day of how it can minimize, reduce, or end some of those restrictions. But if they were to exist in your community, that doesn't stop us from doing assessment. Those sorts of considerations are further along downstream in the matching process, as opposed to being elements that preclude the participation in the assessment process. Some tools have triage instruments as well as assessment instruments. It's important to know the difference between those two to make sure that you're not using triage tools in ways that they weren't necessarily designed, or to make sure that you're not ensuring that a more robust assessment is completed with every single individual and family when information that's gleaned from a triage tool might have been all you needed in the coordinated access process to move further along to the match function. So in a nutshell, triage tools tend to be binary, closed-ended questions that look for the presence of an issue. This is not to be confused with assessment that looks at the depth and complexity of an issue. So think of it as, what happens at the triage desk of a hospital? Are you ill or injured, yes or no? If you are ill or injured, do you need to be at a hospital, yes or no? And then looking at the process of comparing people who might be accessing healthcare within a hospital. Now, that's all triage functions. Assessment is what happens when you see the physician or the nurse practitioner and they go into greater details and might order more tests or bring in other elements of your electronic medical record. The difference being what happens at the front door in the initial engagement versus what happens in a more prolonged and in-depth engagement. Communities are not required to have both triage and assessment tools. They are required to have assessment tools, but having an assessment tool does not preempt a community from having a triage tool if they so desire. So when do we conduct assessments? All right. Here's where we see in a number of communities very different approach to when to conduct assessment, and it's best that we kind of get on the same page across the country of when and how to actually do an assessment in the engagement process with an individual or family experiencing homelessness. So the first thing we should do is diversion. So if you have an individual or family experiencing homelessness, especially for the first time, we shouldn't, on that first encounter, sit down and do an assessment. We should sit down and try to keep them out of the homeless service delivery system whenever it's safe and appropriate to do so. If diversion is unsuccessful, the second thing that we should be focusing on is self-resolution. So what we can be doing as homeless and service providers to create an environment where they are still, family or individual is still capable of resolving their own homelessness without requiring having to go through the assessment process. Third thing that we're going to focus on doing is rapid resolution. What rapid resolution gets at is for those individuals who are not able to self-resolve within those first 2 or 3 days of being in the homeless service delivery system for the first time, are there other tools or strategies that we can be putting in place that might actually help them rapidly resolve that still doesn't require an assessment? So if we think about some rules of thumb that might be applied in the process of moving forward with when and how to apply assessment, we might create a policy within a community that looks something like this. We might say, for an individual experiencing shelter, we first try diversion. If diversion is unsuccessful and they come into shelter, we focus on self-resolution for up to, let's say, 4 or 5 days. If self-resolution is unsuccessful, we might move into the third phase of rapid resolution, and that might continue for another week to 10 days. And if we get to approximately the 14-day period where the individual has been unable to resolve their homelessness, then we do assessment fourth. So we should only be in a position where we're using our assessment tools that are part of our coordinated access process when diversion, self-resolution, and rapid resolution have been exhausted. To look at most assessment tools, they do get into some rather intrusive and personal information. There's really no point in collecting that information from any family or individual unless it is absolutely necessary to do so as we move forward in the process of coordinated access and common assessment. So how can we use the results from an assessment? I alluded to some of these earlier on in the webinar, but let's go into some greater detail. Well, we're definitely going to use them as part of coordinated access. So when we think about a space on a caseload or a vacancy within a housing program with supports specifically designed to meet the needs of, let's say, families, we'd have to look at what is the nature of that available vacancy or that spot on that caseload. If it's for a family that has moderate acuity, we would be looking at our assessment data to say which families have moderate acuity and which of those meet the prioritization criteria that we've established in our community. More on that in the webinar that we have early in the new year. But we're not going to assign that space on the caseload to someone who had higher acuity if it was a moderate acuity opening. We also need to understand different types of people on our by name list. So in a nutshell, that gets into 3 groups. Those people who would be good candidates for continuing to self-resolve, who tend to be lower acuity through an assessment process. Those families and individuals that would be good candidates for moderate or time-limited programs like rapid rehousing or some sort of time-limited rent supplement program. And the third group being predominantly for those families and individuals who have a number of complex co-occurring issues as validated through your assessment process. You can also, through this coordinated access process, see which types of people are actually getting matched and how they do over time. So on the front end of that, how people are getting matched, you in your analysis of your coordinated access data and your assessment data may come to realize that there are certain groups of families and individuals that are matched quite well for whom the process is working. You might also discover that for some families and individuals, the process doesn't seem to be working. They seem to be stuck in homelessness, and the matching process isn't really resulting in positive housing outcomes. You dig deeper into your assessment data, and you may come to appreciate that there are certain commonalities amongst people who have certain presenting issues, as uncovered in the assessment data, who are really struggling to find a match in your coordinated access process. That allows you to tweak and fix your system. You can also understand the needs of specific population groups. To that end, the question that I frequently ask communities is what we think the population is, what the population actually is. In other words, is what we think and what we know the same thing, or are they two different things? I'll give you an example of understanding population groups and where assessment data can be really helpful. There have been historically at least one, sometimes several organizations, especially in mid to large size urban communities, who would lay claim to things like, we are the only organization who serves the hardest of the hardest to serve. And they might have even actually held that narrative for a large period of time, years in fact. When you have assessment data, however, as has been uncovered in some communities, that organization that laid claim to serving the hardest of the hardest to serve maybe didn't serve people who are any more acute than another organization who didn't make that claim. So it's really one of perception versus assessment data providing proof. If we understand the population differently, can we serve the population differently? This gets at understanding different elements that are uncovered in assessment tools. So things like, we might find that there's a certain makeup of a particular type of person or family that is not being well served in your community. And maybe it's the presence of certain variables that are making it more difficult to serve that population group. So can we serve the population differently? Really means if an individual, or I should say a type of family or individual, is being left behind, and we have assessment data that shows their commonality, what can we be doing to redesign or repurpose programs to assist in the matching process based upon data gleaned in the assessment process? There might also be additional pieces of information that are required beyond an assessment to assist in decision making. So this could be things like, maybe the assessment instrument you're using could have supplemental information from your HMIS or HIFIS on length of homelessness. And you as a community might have prioritized that you want to try to house, let's say, individuals who've been homeless 5 or more years first. Well, you might want to look at the information from your assessment tool as well as looking at other data from HIFIS to make a determination of whether or not you can pull from your by name list, or I should say filter from your by name list, just those individuals who have been homeless for 5 or more years. Or maybe you have a specific type of housing program that is specifically catered to youth who have aged out of the child welfare system. You might need additional information relative to their foster or group home history to be able to do that. Or lastly, as we think through more and more specialized initiatives that might meet the needs of veterans, we might need additional pieces of information relative to veteran status to be able to make that work. Where funding is concerned, assessment data becomes really helpful to make sure that our funding is aligned to known needs. It is also one of the experience from other jurisdictions when they have assessment data over a period of time that they come to realize that not all of their investments were aligned to the most pressing needs. In fact, some communities have come to appreciate that even though they thought they were funding the quote unquote right things, that once they had assessment data, there was some funding that needed to be reprofiled if they truly wanted to be investing where the deepest needs were. And from a service provider perspective, given that we live in a world of requests for proposals and proposal writing in response to those requests, we can actually use data from our assessments to write much more informed and thoughtful proposals that speak to the very specific population groups that our organization has had the privilege of serving. The data from assessment can also be critical to service planning. So when we look at it from a service planning perspective, what we can see is whether or not services are aligned to meet the needs and demands of the population, or whether or not our assessment data shows us that there's a type of family or individual that is not well served because of misalignment, and so there's improvements that we can be making there. But service planning can also lead to understanding that there's more questions we have. So that's okay. It's entirely possible that your assessment tool didn't ask every single question that was going to be necessary to help and assist you with service planning. You may want to as part of the assessment process, but outside of the assessment tool itself, add some of those additional questions if they're going to be helpful in the delivery of service provision. So this, for example, might lead you to a place where you had, for example, Indigenous specific housing and supports, but you didn't see anywhere on the assessment tools you're using a specific question about whether or not the individual identifies as Indigenous. You might actually have more questions that you need to ask, and that's a good thing. Your assessment tool should be part of the assessment process that actually allows you to do matching and prioritization in the most robust way. So what do you do if the person or family is incapable of an assessment or refuses to participate in an assessment? Well, coordinated access generally is predicated upon almost all individuals and families in almost all circumstances participating in assessment if they're part of the coordinated access process. But there will be some individuals and family members that are incapable of completing an assessment. In those instances, what we're going to do is look at whether or not they have a legally designated substitute decision maker, in which case that substitute decision maker can be brought into the assessment process to provide information as necessary so that the individual can actually have the assessment done, but just not done by themselves, but can also highlight the need for a capacity assessment to be completed before a housing assessment is completed. Every single community should have a policy in place of what exactly the process will be in those instances if, for example, a street outreach worker deems in their professional opinion someone to be not well enough to provide consent and participate in the assessment process, by which mechanism can that individual then get assessed by a mental health professional to make a determination of whether or not they can complete the assessment or not. And there will be instances where someone is capable of completing the assessment, but just refuses to do so. This will be remarkably rare. And I start with this idea of it being rare only so that you don't start thinking through all the exceptions to the rule. Let's be clear. The process that you put in place for assessment and the processes you put in place for coordinated access generally will apply to almost all people in almost all circumstances. But there will be rare outliers, like a person who says, I want housing, but I'm not doing your assessment. In developing policies for these rare exceptions, I would say the most common approach is to have some sort of proportional allocation. And by that, I mean, maybe it's 1 out of every 100 vacancies that are available in housing, or spots on caseloads that go to an individual that refuses to participate in assessment but still wants housing. And so it looks at also the kind of rare instance where that would actually have to be applied, and that sort of proportion might make sense. If this is a more common approach, a more common occurrence in your community, where you have a large number of people refusing assessment but still wanting housing, then you probably need to look at not just the assessment tool, but the entire process by which you put coordinated access into place in your community. And now we have approximately 10 minutes to take any questions you have. And Ashley will be moderating any sort of questions that any of the participants put into the chat box, if there are any.
I'm not seeing any right now, but if folks if you move your cursor down to the bottom of the screen, you should see chat, and then you can click on that button and just type in any questions that you have to all panelists, and that way we can see your questions. Not seeing anything coming through, but folks might be typing right now.
Give another few seconds. As we do that, we can put up my contact information. Oh, it doesn't look fabulous. This is what happens when you make the switch from Keynote to PowerPoint. Anyway, if you thought of questions in the future that you wanted to follow up on with me directly, you're welcome to email me at idejong@orgcode.com. There's also some resources and blogs that we put out about coordinated access in the past that you can find on our Facebook page. Okay. Any questions come in now?
Yeah, we got a couple that have come in now. So Laura is wondering if there's any suggestions for communities where service providers prefer different assessment tools.
Well, the first thing I'll say is that you have to agree on one tool as a system. So you can't have different providers having different tools. And the process by which that generally gets resolved, if you can't reach consensus, is going to be actually starting to look first at what are your intended outcomes of your coordinated access process. So many communities dissect the tools themselves and say, which tool do we think the word is best? And I would say that that can be misguided. You should pick the tool that's going to best align to the outcomes that you want through coordinated access, as opposed to just trying to look at the different tools themselves.
Great. Okay. We have another question from Janine, who's wondering if you could elaborate on examples of self-resolution and rapid resolution.
Sure. So self-resolution, rapid resolution, there's a lot of overlap between the two and sometimes used interchangeably, but things could be things like family reunification is possible. It just wasn't possible at the front door or the very first instance of homelessness, but over a period of 3 or 4 days through some mediation with family members, now they can go home. So that would be one example. Another example of self-resolution could be an individual actually has a sufficient source of income where they could be in a position where they could afford their own housing and don't need to be housed through the coordinated access process, but they still might need some time and shelter until that rental accommodation is secured. So that might be another example of resolution that happens, either be instituted by themselves or not. When we look at the distinctions between the two types of resolution, what we're often looking at is the amount of staff involvement that is going to be necessary to try to get people to a place where they can resolve their homelessness.
Okay, and then one final question, unless others come through. This is from Betty, who's asking, you use the word resistance in your presentation. Is it resistance or is it about trust?
I was talking specifically about resistance because I could have trust with someone who still resists the idea of doing assessment. They could be fully on board with everything else that we have to offer, but resist any sort of participation in the assessment process itself. But there could be instances where it really is about development of trust that would allow the assessment to occur. But I've definitely seen instances where there's really good trust established and the person still resists participating in any sort of assessment tool.
That's great. Thanks, Ian. There's no other questions that have come through, but I'm wondering, I'll just give a quick reminder to folks that are on the call, just to give you a few other seconds to type in some questions. That this recording and a PDF of the PowerPoint will be posted on the TTA website. So feel free to log into that to listen to this again, or if you feel it would be helpful to share with some of your colleagues and share this learning with them. And with that, I'm not seeing any more questions.
And Ian, I'm wondering, this is Marie, if you just want to remind people about the topic and when the next webinar is coming up.
Yeah, so the topic of the next one is prioritization. It's the third in the trilogy of coordinated access webinars that we are doing. I believe it is on January 2nd.
Yep.
I don't have the time right in front of me, but if you go to the Canadian Alliance website in the TTA section, they have a list of all their upcoming webinars, and that one will be included there.
That's right. I believe it's 1 p.m. and I think sometimes there's value in registering, even if you might not be able to attend, just to ensure that you are the first to receive follow-up materials.
Oh, you know what? We have had one other question come through. If we have a few more minutes, if that's all right, Ian.
Yep.
So do you have any recommendations for communities that are currently very siloed? How do we start to move toward coordinated access before the community is prepared to take this on? Is there a place for nonprofits to pioneer any of this? And that's from Courtney.
Terrific question. So let me try to dissect different parts of it. So the good news is we don't have to have coordinated access in place overnight. That's the good news. And most communities are going to need to go through a process of figuring out how do we move towards alignment. I say the best place to start with coordinated access isn't about the instruments or the tools or even all the technical elements of it. It's about having a community conversation regarding principles. What are the things that we hold in common as we want to move forward with working towards responding to homelessness in such a way that we can end it in our community? And if we have principles that are aligned, our values and beliefs are aligned, then our coordinated access process and the tools that we choose should flow from that. If we don't start from a place of principles, then it's going to continue to likely be siloed, because it's about everybody's individual interest and their organization as opposed to a shared community interest. As to whether or not there's a place for nonprofits to pioneer any of this, absolutely. Some of the best coordinated access or coordinated entry processes that exist were ones that were driven by service providers who are nonprofits, as well as nonprofits that don't do service delivery, but are interested in the issues of homelessness, and that it can occur outside government. There's going to be a place, if you're receiving Reaching Home funds, where there needs to be some coalescing around what the approach is going to be to spearhead all of this as we kind of move forward. But don't underestimate the value of having some really well-intentioned nonprofit organizations lead the charge in the conversation, or especially to lead off with discussions around things like the shared principles.
I think that's it. We've just got a couple thank yous coming in now.
Well, and thank you to the Canadian Alliance for having me do this webinar, and thank you to the participants, and I'll turn it back over to Marie and Ashley.
Great. Thanks so much, Ian, and thank you to you for this excellent webinar on assessment, and we're looking forward to the future ones, and we just want to wish everyone a happy holiday. Thank you so much. Bye now.